Hypertension. Our group chose to do hypertension because of how frequently we see the disease in the patients we care for. It is so common that nearly half of all adults in the U.S. are diagnosed. It is important for us as nurses to be knowledgeable about hypertension and its effects, as it can affect patients of all ages and lead to serious complications. Hypertension is diagnosed as multiple consistent blood pressure readings above 130/80. It is more common among men and more prevalent along the East Coast and southern states. Untreated hypertension can lead to damage of the heart and vessels, leading to complications like heart disease or stroke.
There are two classifications of hypertension. These include essential and secondary. Risk factors for essential hypertension include family history, excess sodium intake, a sedentary lifestyle, obesity, excessive alcohol use, smoking or tobacco use, high stress levels, hyperlipidemia, African Americans, age older than 60, and being postmenopausal. Risk factors for secondary hypertension include kidney disease, Cushing's disease, primary aldosteronism, pheochromocytoma, brain tumors, encephalitis, medications such as estrogen, steroids, or sympathomimetics, and pregnancy. Symptoms of hypertension can include a headache, especially in the morning, facial flushing, dizziness, retinal changes and visual disturbances, and nocturia. There are currently no specific lab tests used to diagnose hypertension. However, there are several tests that can help identify causes of secondary hypertension and target organ damage as well. BUN and creatinine elevation indicates kidney disease. Increased serum corticoids may indicate Cushing's disease. Various blood glucose and cholesterol tests can identify factors relating to blood vessel changes. An EKG can be used to evaluate cardiac function. Tall R waves are commonly found with left ventricular hypertrophy, and a chest X-ray can reveal cardiomegaly.
The goal of treatment is to maintain a blood pressure that is less than 130/80 mmHg. This can be done by administration of medications, lifestyle changes, or a combination of both. Medications are generally added to treat hypertension that is not responsive to lifestyle changes, but is also based on cardiovascular disease and past history of heart attacks, stroke, and peripheral arterial disease. The first line of medications are diuretics, also known as water pills, such as furosemide. Others include ACE inhibitors such as enalapril, beta blockers such as metoprolol, and calcium channel blockers such as amlodipine. Although treatment with medications may be implemented, lifestyle modifications are also necessary. Changes in nutrition and physical activity are examples of some of these modifications. The DASH diet focuses on daily and weekly nutritional goals rather than requiring special foods. Increased physical activity has also shown to reduce systolic blood pressure by almost 4 to 9 mmHg. Start off with small and gradual amounts of activity at least 3 times per week with activities such as brisk walking, muscle strengthening, or jogging as tolerated. Complete cessation of smoking is recommended as smoking increases blood pressure for 30 minutes after each cigarette. Limit alcohol intake to no more than 2 servings per day for men and 1 serving per day for women, as drinking alcohol can increase your blood pressure. Once blood pressure is controlled, patients should monitor their blood pressure at home a few times per week to note if blood pressures are above, below, or at expected range. You should use the same arm for each measurement and allow at least 2 minutes between readings. Preventing, diagnosing, and treating hypertension will require consultations from cardiology and potentially physical therapy and nutrition. Luckily, the community and resources available for individuals with hypertension is immense, ranging from support groups to peer-reviewed journals. Visit the Centers for Disease Control and Prevention for up-to-date information and fact sheets about hypertension and related conditions. You can also visit the U.S. Food and Drug Administration for a revised booklet of antihypertensive blood pressure medications. Finally, visit the American Heart Association for interactive guides for talking to healthcare professionals, printable blood pressure trackers, and support networks.